Hi, I'm Dr. Michael Wilmink. I work for OSNA, and I work at the AOA division of OSNA. I grew up in Vancouver, came down to UCLA for my regular undergraduate education, then went back to Vancouver for medical school and residency. Finished in 2002, and then subsequently moved directly to Arizona. I've been practicing here in the Valley for about 9 years. I'm a Canadian Royal College certified orthopedic surgeon, and then in 2004 I became an American board certified orthopedic surgeon. Something that we've begun to diagnose recently is rotator cuff disease of the hip, and this is when patients have tears of the gluteus medius and minimus tendons at their insertion point into the greater trochanter. What this results in is pain around the hip and especially weakness. And if you examine them, they'll have a very positive Trendelenburg sign because they have very much weakness in terms of abduction of the hip. The initial treatment for that is usually conservative management with anti-inflammatories, some topical creams, physical therapy, and injections, but there are certain patients who just don't get better with those treatments. Those patients need to go on to have an MRI where we could diagnose these tears, and then management can then go on to be such things as injections or further therapy, or occasionally we'll treat these patients arthroscopically for debridement, or some patients actually require repair of the abductor muscles. And these patients actually have very good recoveries and are almost have immediate pain relief, but there is a period of 6 to 12 weeks for recovery. Within the past 5 years, orthopedic surgeons have began to do arthroscopy of the hip. It's a joint that's difficult to get into with the scope, but there are certain pathologies that are very amenable to treatment with the scope. Labral tears, as well as cam impingement or pincer impingement, which basically means that you have a ball in a socket and the bone has grown too much around the socket and the bone is hitting the edge, and that's causing restriction and pain. These patients are typically in their 30s and 40s. They complain of deep pain, deep groin pain. These patients typically do quite well after these minimally invasive surgeries and get back to full function, and part of why we're treating this disease is to hopefully prevent arthritis in the long term.